Hello, my name is Professor Alpaslan Şenköylü, and this program is the first program of 10 questions and 10 answers about your health problems. As I mentioned before during our clips, this program will be about scoliosis. And first question about the scoliosis. What is the meaning of scoliosis? The meaning of scoliosis is a kind of three-dimensional deformity of your backbone, which means you may have deformity in your frontal plane, of course, and of course in the lateral plane, and also axial plane. And this sometimes actually end up with some serious health problems. The most common type of scoliosis called adolescent idiopathic scoliosis. It develops in children between the ages of 10 and 15. Idiopathic means there is no known cause. Most types of scoliosis are more common in girls, and scoliosis can run in families actually. And about 30% of teens who develop scoliosis have a family history of disorder. If a child has a parent or sibling with scoliosis, they should have regular medical checkups to see if they are developing a spine curve. Parents often ask doctor if there is anything they could have done to prevent their child's scoliosis. Unfortunately, the answer is no. The second question, what are the signs and symptoms of scoliosis? One shoulder or shoulder blade is higher or prominent than the other, and sometimes one hip is higher than the other one, and in most of the patients the head appears to be off center, and we generally use the Adams forward bending test. And in this test, when the child bends forward, one side of the back is higher than the other. The spine curve often starts gradually and then becomes more noticeable when a child has a growth spurt and the curve becomes more severe. How is scoliosis diagnosed? The scoliosis is diagnosed through a medical and family history, physical exam and X-ray examination, of course. In X-ray examination, it shows how severe the curve is, as well as its location and shape and pattern. Our fourth question will be, what happens if scoliosis goes untreated? If a teen has a more than 50 degrees curve in their spine, the risk is fairly high that in next 10 or 20 years. And the scoliosis will continue to progress during adulthood. That's why our threshold for the surgical treatment is 50 degrees in most cases. Scoliosis can progress average 1 or 2 degrees a year. That means that a teen with a 50 degrees curve should end up with a 70 degrees curve by the time they are in their mid-30s. That's quite a noticeable curve. In addition to the issue of appearance, a severe curve can cause arthritis, back pain, and also sometimes pulmonary and cardiac problems if they actually go out 90 or 100 degrees. And this caused actually rib cage press against the lungs and heart, and making it more difficult to breathe and harder for the heart to pump. Our fifth question will be, when is a brace used to treat scoliosis? The doctor may recommend wearing a spinal brace for children who are still growing and have a moderate spine curve between 20 degrees and 35 degrees. Some braces are worn all the time. Mostly I use this one actually. Sometimes some braces use part-time. Children who wear braces can usually participate in most activities and have a few actually restrictions. And the brace compliance is very important and should be worn 23 hours a day. We can take out the brace just during the bathing or some kind of self-caring activities. There are different types of braces. The particular type of brace that is the best depends on the type of the cure they have and where it is. In some younger children with a smaller cure, wearing a brace full-time for a year may correct the cure completely. If an X-ray shows that after a year of wearing a full-time brace the spine is straight, the patient can switch to a part-time brace for another year. The doctor may recommend going without the brace at the end, but this actually should be decided after monitoring closely of the patient. Our sixth question is, when is surgery recommended for scoliosis? Surgery is often used to correct the curve and stabilize the spine when the curve is severe, generally more than 50 degrees. Bracing has not been effective in halting the progression of the scoliosis, and the patient is still growing. The seventh question will be, what happens during scoliosis surgery? The surgery typically lasts 4 or 5 hours, including the preparation time. The surgeon opens the back and exposes all the way down all of the spine and fuses several vertebrae. Vertebra means a backbone, actually, in the spine. Pieces of bone or synthetic bone-like material are placed between the vertebra. The metal generally actually should be titanium or chrome cobalt. Rods, hooks, screws typically hold the part of the spine straight and still while the old and new bone material fuses together. And we never actually remove these implants. And generally, we correct the spine not only in the frontal plane, but also lateral plane and also axial rotation. What are the risks of the surgery? Complications of spinal surgery may include bleeding, infection, pain, and of course, paralysis. Rarely the bone fails to heal and another surgery may be needed sometimes. And very rare complication is paralysis. It's actually less than 2%. And generally we use the neuromonitoring in order to prevent this problem. Generally, I personally tell the patient, risk is about as great as the risk that you are playing with crash when you go on vacation. While in the past, patient needed a blood transfusion, we now use special techniques in order to avoid actually bleeding. And most of the idiopathic scoliosis surgeries, we don't need actually blood transfusion. Ninth question is, what is the recovery from the surgery like? The day after surgery, patients, with the help of a physical therapist, get out the bed and start walking. And every day she walks or he walks a little more, and 5 days on average, she can go home. 6 to 8 weeks after surgery, actually the patient can go for school, and personal physical activities can be started immediately after surgery. We generally don't remove the stitches because we actually use aesthetic stitches, and which is the hidden stitches, and some kind of contact sports, and also some kind of games like football, basketball, or volleyball can be started after the 6 months. But as I mentioned before, the patient can start immediately after to swimming, or cycling, or walking, or running. 10th question will be, can alternative treatments such as yoga, chiropractic treatment, massage, or physical therapy help treat scoliosis? There is no scientific evidence that shows these treatments can reverse or stabilize scoliosis. But no harm to do all of these things. Sometimes physical therapy can be helpful before and after surgery in terms of the recovery and preventing the complications. But it will not correct the cure itself. Exercise, while it does not prevent scoliosis from getting worse, helps people with the condition stay physically fit and keeps bone strong. Thank you very much for your attention, and I will see you in another interesting program. Stay safe.